In 2010, over 400 children in northern Nigeria died in a lead poisoning epidemic directly related to artisanal gold mining. The humanitarian organizations Doctors Without Borders and TIFO partnered with the local, state, and federal governments to address the outbreak and related environmental contamination using the CHASM model. Like much of the world, artisanal mining is on the rise as mineral prices increase and climate change makes traditional livelihoods like farming and herding increasingly difficult. In Nigeria, CHASM was used to identify pathways of exposure to heavy metals and then to break those pathways by remediating the environment and implementing a safer mining program. TIFO and the Zamfara state government hired over 400 locals, mostly miners, and trained them in remediation. Occupational hygiene practices during remediation were also used in developing safer mining practices. Environmental remediation methods were modified in collaboration with Nigerian partners to meet local customs and to be feasible for government technicians to repeat later in the project and in future endeavors. In Zamfara, remediating the environment and implementing better occupational hygiene practices had significant impact on both human health and ecological health due to reductions in soil and water contamination and better controls at mining sites.
So Hassan and I are standing now in what was the center of the worst of the contamination here in Doretta, up to 6-7% lead and high mercury numbers, and we found that contamination is about a meter deep.
This is the map of the Tungadaraj village, one of the villages we operate in right now, and it shows you the compounds and the exterior areas that need remediation.
Community health is the entry point for these projects. Addressing human health issues results in improvements to the entire ecosystem. By focusing on collaborative projects and capacity building, CHASM results in sustainable improvements to environmental health in mining communities.